Grüezi ragazzi, welcome e bienvenue to Cannabis LinkedIn Live for this week. To those of you joining us live, thank you very much for being here with us today. And for those of you who will be checking out the video at a later time, also a big thank you to you. We hope you enjoy it and that you perhaps have left today's session having learned something new. Before we get started, just a little intro about Cannabis Cannabis aims to combat the bottlenecks of the medical cannabis industry using the power of education and through the training of healthcare professionals on the effective use of cannabinoid medicines. In doing so, increasing access to medical cannabis for patients worldwide. On your screen right now, you see an overview of our services as well as a QR code that you can scan to get in touch with us. Now, one last thing that I want to tell you guys about before we get started is the upcoming release of our Principles of Clinical Cannabinology Handbook. And we are fortunate enough to also be joined today by one of our extremely valued contributors. The release is just around the corner. It will be on May 2nd at the Cannabis Europa conference. And amongst other things, the book covers the endocannabinoid system, clinical practices, regulatory landscapes, as well as available products in different jurisdictions. If you're interested in learning more about the handbook, reserving your copy, or even learning about sponsorship opportunities, please scan the QR code on your screen and get in touch with us. And last but not least, if you haven't already, please head over to the Cannabis LinkedIn page and hit that follow button. We try to make sure that anything that we post is interesting and of interest. And of course, we have every week our weekly LinkedIn Lives. So without further ado now, I would like to welcome everybody to the session for today, where we will be discussing the differences between males and females in medical cannabis therapies. And joining us today is Dr. Mary Pena, a physician with many years of administering cannabis in her patient therapies. And like I said, a valued contributor to our upcoming Principles of Clinical Cannabinology Handbook. Mary, thank you very much for being with us today. If I may please ask you to give an intro about yourself as well.
Well, thank you guys for having me. I'm ecstatic to be here with you today. It's really excited. I am a Colombian physician. I was born and raised in Colombia. Then I've been living for the last 11 years in Spain. My clinical practice has always been around mental health and psychiatry, but I've also worked with dementia, neurodegenerative disorders, end of life care and support. And the last years of my practice, I've worked full time on using cannabis and cannabinoids, cannabis extracted products from the plant of the gather as it today as medicine in a platform that's Calapa Clinic. I was part of the clinical team in Calapa Clinic using cannabis as medicine.
Thanks a lot, Mary. It's a great pleasure having you here. We had the pleasure to see the contribution of your work and also, in a sense, give voice to all of this contribution that perhaps sometimes they are carried out, if you will, in the solitude of the medical office, of the medical doctor office, but then they kind of don't have the chance to also set a sort of, I don't want to say standard, but at least a second opinion or a support for other doctors that are approaching this topic. And so it's been incredible to have the opportunity of, the support of doctors, experienced doctors like yourself, to basically show us what you're doing with your patients. And today's topic, we wanted to revolve it around this interesting paradigm of utilizing cannabis in gender differences, and whether that's actually something that we should look at, or we're just looking at different, if you will, pharmacokinetics or metabolism of single individuals, or whether we can sort of categorize as well amongst female and male. So as the time, it's always very short in these lives, and I know the people in here want to know it all, I will just start and go ahead, perhaps asking you with a bit of the questions that I set up for today. And one of the things that we've been looking at, it kind of in the recent years, because the publications around this topic, they kind of are popping out over the past 5 years on trying to really figure out the use of cannabis in between female and male. And I think this is particularly relevant because as we look at cannabis therapy, a lot of pathologies where the symptoms, if you will, that we define psychosomatic symptoms, they tend to be associated with female related, or at least a population that is more present in female. I'm talking, for example, fibromyalgia, I'm talking GI issues, but clearly, since you are the clinician, I'm sure that you can tell us a little bit more. So the first thing I wanted to ask you was whether there is a reason for this difference regarding cannabis therapy between male and female, and whether you found a condition or a symptomatology that is affecting perhaps primarily women or primarily men that can match better or worse with cannabis therapy.
Great. I think we can see this through two different views. So I am a big fan of the work of Shiva Cooper. She is a physician and researcher in the States, and her group have been working on trying to find out these differences both in preclinical research and human research, which is what we really are thirsty for. I think the first thing to consider is that in general, science and medicine have always been biased towards males, and women, we only started being part of the research in the last 30 years, really. So there's still a lot we don't know about the sex difference in metabolism in general. That's why women, we tend to have more secondary effects with pharmacological resources if we compare ourselves to our counter males. So it's been interesting. Obviously, we are still lacking lots of data, but from both preclinical research and human, we start to see that there might be differences in the endocannabinoid systems or the response we have to cannabinoids if we see males and females and we compare each other. It seems that women, we might be more sensitive towards the nociceptive and analgesic properties of cannabinoids, but also at the same time, we might be more sensitive to secondary effects of cannabis, but that is in the acute consumption. But if we start having a frequent use, seems that females tend to develop more tolerance and more withdrawal symptoms. So I think this is super interesting. The explanation behind this is that we might have a difference related to the sexual genetic difference on the chromosomes, but then the hormonal apparatus of the female physiology plays a huge part. We know that is a direct communication and bidirectional between hormones and the endocannabinoid system. We might have, as you said, pharmacokinetic difference, and women we may metabolize and deposit cannabinoids in a different manner. And we might have even pharmacodynamic differences, as we know that the sensitivity, the affinity, and the expression of CB1 receptors might change during the menstrual cycle. So there are lots of things to consider that. And then I think as well it's interesting to consider the theory of the clinic endocannabinoid deficiency as a syndrome. Because if we take into account that many of these conditions that we might find explanation through an endocannabinoid tone that is functioning lower, as fibromyalgia, as migraines, as irritable bowel syndrome, some of these conditions get expressed much more in females. I think this has to be, obviously we are under different stress, acute and chronic stress. So we female might express these really difficult to treat painful conditions in a more frequent manner. So I think under those two scopes, it's amazing to consider the possible difference between the endocannabinoid systems among gender and sex.
This is really interesting. I also wanted to add to anyone listening that we did touch in a previous live, the topic of, for example, how the hormonal cycles can change as you just said, even the pharmacodynamics of the cannabinoids on our physiology, which I find absolutely very, very interesting and fascinating topic. But then to remain here, so based on this understanding, do you have any suggestions for anyone listening, especially healthcare professionals, on whether there are like any special precautions that perhaps a woman treated with cannabis should take compared to a man, or vice versa?
Absolutely. I think there's still the amount of evidence we have. It's not enough to have some sort of clinical practice of pearls. But in my practice, I always try to work with my female patients to use different dosages through the different parts of the cycle, of the menstrual cycle. This is not always easy because not many of us are in touch with the different moments we have during a month. But with women that embrace the cyclic nature and really pay attention to the difference they experience through the month, it's really interesting to work in changes on the dosages in certain parts of the month. That has led me to being able to treat females for long periods of times, years and years, without experimenting any tolerance. So I think that's important. Also, I think a way to tackle tolerance is to have periodic breaks. That is important whenever it's possible to do. I think for physicians starting their practice, it's always important to take into account that women, especially young women, tend to have a lower blood pressure. So we have to be precautious when we start, taking into account the vasodilation that cannabinoids might produce. So staying hydrated is a key thing. And for both sexes, basically, we haven't discovered anything new under the sun. That what Franjo told us so many years before: start low and go slow. Probably that is the biggest piece of advice. I think the way I see my clinical practice is we cannot have algorithms or protocols towards dosaging or what cannabinoids are going to be using, because that depends on our patient. We're not treating diseases, we're treating patients that have a unique endocannabinoid tone. So we really need to adapt to that patient, whether they are naive or they have a history with cannabis. Those are extremely important things in order to start and decide what products are we going to use. So my biggest piece of advice for any young physician would be listen to your patient. That probably is going to be the best approach.
Look, I think you just nailed it with this sentence saying we are not treating the symptoms, we are treating a patient. And this really shows and highlights what's the essence of medical cannabis therapy, which really is tailoring a therapy to a person, first of all. And this has really been the reason why I obsess so much, I coming from science, on saying, well, in the making of this book, if I just deliver a sort of summary of all the literature that there is out there, of course this is useful, but then it still will have a gap in between the perfect theory and the reality, because the reality that my friends and my colleagues are facing as healthcare professionals is actually a reality with patients with different comorbidities. They don't have just one pathology, that everything is running like in the perfect book. They may come after years of different therapies that might have completely disbalance their physiology in other ways. So we need to kind of first rebalance and understand how we are inserting the cannabis therapy. So in this regard, the contribution that yourself and other colleagues have done, I found it extremely valuable, because the idea is exactly that: is we are not trying to treat symptoms at the end of the day, but we're trying to improve the life of a person after another. And on this, I would like to link back also to a previous live that we had with another doctor that contributed to this book from Malta, and Jean-Claude Cicluna. And he also said something regarding, for example, he was describing a case study that we included in the book about patients with migraine. And, he was saying, well, perhaps this is not relevant for, statistically relevant, but what really meant for that person going from several, migraine attack a day to perhaps one every 3-4 months, it's such a huge difference in the life of this person that we as doctors, like, this is what we should be starting to focus on. And of course, it's great if we can, endorse our work with the double-blind placebo control, but this is also the reality that we're facing. And so just to attach on this conversation, I was wondering if you would mind sharing with us one or two case studies that you found particularly perhaps compelling to describe differences between male and female in the case studies that you showcase with us.
Absolutely. I'm gonna use two different cases that are different to the ones I shared in the manual and my contribution, because I think these two cases I'm gonna tell you quickly about really portray the difference, because it's the same disease, fibromyalgia, and same prescriber, same products, but a total different result. We have a male that he was around 37 years old, but he had been diagnosed with chronic pain and fibromyalgia since he was 17. So it's been over half his life that he's lived with this chronic pain. Also, the chronicity and the amount of analgesia in pharmaceutical form play a key difference, because the more we live with pain, the more we tend to develop central sensibilization and all the problems regarding that. And the more analgesics we have in a patient, the more risk we have to paradoxical responses. And on the other hand, I had a female with fibromyalgia. My male patient abandoned treatment after 9 weeks. And my female patient continued treatment after 2 years. And one of the remarkable things about this patient is that she was able to have a dosage of cannabinoids lower than 2 years when we first started. I think that is beautiful. I think that's remarkable. I think many of the reasons why we had such different response is as well that this female patient, she was recently diagnosed with fibromyalgia. She was reluctant to have lots of analgesics and painkillers. She was really looking for alternatives, and she used other suggestions as she really paid attention on her nutrition. She used other alternatives to work on her mental health, as meditation, mindfulness. She used Chinese traditional medicine. And one of the things that really touched me of this case is how much this patient gained on her quality of life. She got her mind back. She said that being able to work properly and have a clear head was amazing for her. And then her physical performance got it back. Before she was diagnosed, she was a woman that was very fond of boxing. And for her, it was impossible to get back to boxing since she had all this pain that basically was enabling her to function. And she did get back to boxing. And the last thing is that she got her relationship back with his husband at all levels, emotionally, but also sexually. And I think we don't take into account how much our sexual activity determines our quality of life. And as you just said, Viola, quality of life are those things that are really hard to measure on a clinical trial. And quality of life is what medical cannabis is all about. So there's my little comparison between males and females with the same disease.
Thank you. It was fascinating, actually. And I think it always also goes back to a very important aspect of therapy, which is also compliance of the patient, but also the ownership and the responsibility that each of us has actually amongst our own health. So independently of what's happening to our own biological physiology, we also have the chance to decide what stays in our psychology. And that's a very important factor too. And I think perhaps because also of your background, and this as a neuroscientist, perhaps I'm really interested, but I was wondering also if you'd notice in different patients, the ones that were perhaps, as you said, like putting together like a pharmacological therapy, like using cannabis, but also together with other techniques that not necessarily use any compound, but that are kind of internal, whether there has been like a better outcome. Because as you just said, I mean, to arrive to the point of decreasing, usually no therapy, you decrease the quantity. So I think something really happened there. Yeah, could you add a comment on this?
Absolutely. And the first thing is nutrition. We know that we can affect the endocannabinoid tone by our diet. It's nothing but healthy fats that are the main brick to build endocannabinoids. So we need a good balance between omega-3 and omega-6. And sadly, most of us in European countries and developed countries, we don't have a good diet. I think the food industry should really be accountable for the poor health lots of us have. And we do have the responsibility to research on what are we eating and what's the quality and the source of that food, because that's going to affect our health in every aspect, and absolutely critical to the endocannabinoid tone. Then I think physical activity is a thing that we all know it's a really important part of our health, but few of us, people that we have sedentary jobs, we tend to forget and get glued to the chair. And another thing that I think we really lost track of is how we distract ourselves, how we enjoy our day-to-day life, our habits that we do not only because we have to do it, but because we enjoy listen to music, sexual activity and expression, being out in nature. Those are the things that keep us healthy. I really think that after 2 years post-pandemic, and we haven't really learned anything. Health is about having a good relationship between us, a good relationship with the environment and animals. I think if we can manage to have those three working, we should have a better health in general as humans. So absolutely, we need to exercise and improve all these other aspects of our life that we never take into account. It seems like we are totally dependent on the pharmaceutical model. And I think we need to get back our own dependence. And the first thing would be food and nutrition.
I couldn't agree more. Perhaps I would also add the resting, since we also usually tend to lead and I'm the first one guilty of charge, very fast going lives. And then in this equation, we forget that actually we can disrupt our endocannabinoid system also with disrupted sleep, or with the lack, as you said, of recreation. Basically, that's what recreate, like we just come from Eastern, which is all about resurrection, but the importance of, in Italian we say dolce far niente, the sweet doing nothing. It's actually really fundamental to rebirth and to manage basically then the moments in which we're asking our bodies to push energy into it. I know that we have the last 5 minutes together, and perhaps this is a very long question. So if you want to just give us like an extreme summary of it, because I know some people would really like to know, since you operate in Spain, if you could give us a little glimpse of the scenario, because everyone is wondering how comes such a important country in the European Union is kind of out of the picture of the whole medical cannabis industry. What's going on? Could you please enlighten us for a moment?
Wow. Let's see if I'm up to the task. A Spanish relationship with medical cannabis in 2 minutes. Right now, we don't have a legal framework to work with medical cannabis. This has been debated and discussed in the Congress. The Congress reached the conclusion that the Spanish Agency of Medication should give us a guide or a framework. This should have been published last December, but we are still waiting. We have a new Minister of Health, and he started his new position last week. And apparently, he's not being aware of this whole process. So it's very sad, the situation that we have currently in Spain. I think there's a complex relationship between cannabis and Spain because geographically, Spain has had such a big it's part of the big picture into how cannabis entered into Europe. We celebrated Spannabis last month, and it's been going on since 2003, the biggest cannabis fair, at least in Europe. So it's really sad that with people that know so much about growing and cultivation, we have the best preclinical researchers in Madrid. We all know Manuel Guzman, and we all respect him. We have doctors and physicians as me that have years of experience using these substances. We have thousands of patients, and yet we don't have the dignity. Patients and physicians, we are no criminals. I think the situation is so complex, and probably there are so many different interests at stake. I think this is far beyond political will and bureaucracy. But the only positive thing that I can say is that the key is education. Through education, we're going to change a stigma, and that's why I salute you guys for what you do, Cannabicenza, and I'm always so grateful for whatever invitations you guys give me, because it's only through sharing knowledge where we're going to change the situation. I long for patients in Spain to be able to benefit from medical cannabis. Spain grows. The growth of medical cannabis in Spain has expanded exponentially by 10 times. They started with 600 kilos, and now it's 6,000 kilos. That is cannabis grown on the Spanish soil that gets exported, and the Spanish patients don't have access to this product. I think that is not fair, and hopefully we have a change in the situation in the near future.
Definitely. And thank you for supporting this process so that actually other physicians can work with the possibility of work and not having to be sort of clandestine in their work. And thank you for remarking what we also share as a vision, as in, well, the best kind of change that perhaps we can do is being a little drop that can carve a stone. And I believe it works. It is a work that requires perseverance and passion, but luckily we are surrounded by people just like you that have been going in this direction and continue to go in this direction undefeated. So actually, I salute you and I thank you for what you're doing, because differently from doctors from other countries, it really, to operate in Spain, it requires so much patience and perseverance to not give up on this. And without people like you, patients here wouldn't really know where to go, would have to go in different countries, and would be even more elitaristic. So thank you.
Thank you. Grazie mille for having me, guys.
Indeed, it is not easy to blaze new trails, but somebody has to do it. And we are extremely grateful to not only have welcomed you today on our LinkedIn Live, and I have to admit it was extremely interesting. Also, you provided a very lovely overview of the situation in Spain and how paradoxical it actually is. I think we have a session talking just about this coming up in a few weeks. So everybody watching, please be sure to keep an eye open for that. Dr. Pena, thank you so much for taking the time. We really appreciate you coming on. Thank you for the work that you're doing. And I think we have to have another session at some point in the not too distant future. It was an absolute pleasure. To everybody that's watching, if you enjoyed today's session, drop us a thank you, or drop a thank you for Dr. Pena in the comments. Give it a like, share it. The more that you interact with the stream, the more people get to see it. We appreciate every single one of you. Dr. Pena, again, thank you so much. And we wish everybody a great evening, and see you next week on Cannabis LinkedIn Live. Bye, guys.
Thank you.
Bye. Thank you.
Thank you, guys.